Moment, or no, we're going over to Dr. Russo.
That's
Nicole?
right. Thank you so much. Welcome back over here to the couch. If you're looking up a way to freshen your appearance for the spring, well, this segment is for you. We've got Dr. Daniel Russo joining us with Russo Facial Plastic Surgery Clinic and Med Spa. And Doctor, you've been coming on a long time. I always love talking to you because you've got some cutting-edge stuff that you always show me. I'm so always surprised.
Well, we're always trying to, find things that are going to make things easier for patients, and so they can get back into the swing of things quicker. Most of our patients have busy lives, and they want to do things that don't take much time to bounce back from.
What are some things that we're going to show our viewers today that can really freshen up your look for spring?
Well, obviously, spring is around the corner, even though it doesn't feel exactly like that. But spring is here, and we're thinking about getting out in the sun again, and we have to be careful about sun exposure. So of course we want to do things to protect our faces and bodies from the sun with sunscreens and hats and protective clothing. But there are some things that we can do even to improve the quality of our skin as well. And one of the things that we're using now that really is very nice and minimal downtime for patients is a new device. It's called a DermaPen.
DermaPen, okay.
And the DermaPen basically is a fractional micro-needling device. It has multiple very small little needles that just barely pierce the surface of the skin, but do it hundreds of times. Patients really don't feel it. It's very, very minimally noticeable. But it can make a big difference in the quality of their skin. For patients that have acne scars and some early fine wrinkling and sun damage, it's kind of nice because it induces collagen production in the skin with minimal downtime. Literally, the patients are back in the swing of things the next day.
Well, and I hear a lot of friends out there doing the chemical peels. How do you do these different than what you might get at the spa? Well,
the spas are a very light peel, and again, they may be a little flaking for a day or two.
Okay.
The peels that we use are medical grade peels that are really only done by physicians, and it can cause a dramatic improvement in the skin quality. Really get dramatic collagen induction, but it takes time. You have to give it a week or two to heal from these procedures, but it can give you results that you just can't get any other way. There's no way to get that kind of a change or improvement in the quality of the skin unless you do something a little bit more dramatic. And as long as it's being done by someone who's very knowledgeable about how to do these procedures, it's very, very safe to do. But there's a lot of experience, and like anything, I think you have to use these, both the devices and the peels, like an artist would use paintbrush.
That's true.
So there are definitely some differences that way.
Is resurfacing the same thing, or is resurfacing something different?
Well, these are all resurfacing type modalities, but this one here, plasma resurfacing, is done with a device that blows a little puff of nitrogen gas onto the skin, and it passes some thermal energy into the skin and really helps with the quality of the color of the skin. So patients that have splotchy pigmentation, things of this nature, it's really a great device. Minimal downtime, virtually no pain at all with this plasma device. It's just a different technology. Again, use it for different types of things. So we like that for patients that don't have a lot of bad wrinkles, but have a lot of what we call dyschromias or pigmentation irregularities.
Well, you've got to come back more and tell us more about all of this, because you always make people look even better than they already look. drrusso.com for more information. The phone number on the bottom of your screen, and awesome lasers too. I just learned during commercial break you can even do a laser for this wrinkling under the eye. Good to know. We appreciate it.
Thanks, Nicole. Thanks for having me.
Of course. Don't go anywhere. Up next, we are in the kitchen for a final taste.
Attention injury victims. If you